afternoon, everybody. Welcome to this session on early childhood and preschool programs. We are really delighted to see you here, and we have a very packed and esteemed panel of like-minded people and kindred spirits. All of us are early childhood development enthusiasts, and we've known for many years that this is really the key to unlocking and the potential of every child, and particularly children with disabilities. You know, we have a global crisis in the world that 43% of children in low and middle income countries are not reaching their developmental potential. And this is appalling. And the answers lie here with these wonderful panelists. We have definitely the most packed panelists, and we are hoping for a packed room in the next few minutes, for sure. So without further ado, because we have so much to say here, I will hand over to Daniela, Avilez, and Carla Mauch from Mais, Diferenças to talk about their program on the right to play in Sao Paulo.
Thank you, Nafisa. Good afternoon to you all.
Can't they show the presentation here?
Yeah, let's. Yeah. Going? No, forward. No, forward. Yeah, thank you. Good afternoon to you all. My name is Daniela de Avilez Demôro. And I am Volkswagen Group Foundation Director Superintendent. And on behalf of our institution, I would really like and immensely like to thank you and to thank the representatives of the Essence Foundation and Zero Project Conference for this opportunity, which really symbolizes an important achievement for Brazilian inclusive education. For more than 40 years, the Foundation has dedicated its efforts to advancing positive transformations that drive improvement in education and empowering citizens to promote community development. And to that effect, the Foundation aims to move people through knowledge, embracing three causes: urban mobility, social mobility, and the inclusion of people with disabilities. Since 2017, Brincar project, represented here by my colleague Carla, has been one of the projects that we developed to move towards inclusion. Its aim is to strengthen public policy related to inclusive education, promoting accessible pedagogical practices in public primary schools, in partnership with the NGO Mais, Diferenças and Municipal Education Department of the City of São Paulo, responsible for the largest public education system in the Southern Hemisphere. We invest in teacher training, in the application of methodologies in classrooms, and in interacting with students and their families. In the next slides and video, we will have the pleasure to present some of the main strategies and results of the Brincar project, Brincar meaning play in Portuguese, which has already benefited more than 30,000 people. These achievements endorse the commitment of the Volkswagen Group Foundations to continue supporting quality schools for all, which value and respect differences and promote learning opportunities, embracing and including every individual without exception. Carla, the floor is yours. Thank you.
Thank you, Daniela. Hello. Good evening, everyone. Oh. Thank you for having me today. Please excuse my English. My name is Carla. I'm pedagogue and general coordinator of Mais Diferenças, in Brazilian NGO that works to ensure the implementation of inclusive public policies. The project Brincar team works in close collaboration with the educators. Together, we develop affordable inclusive teaching materials with the intent of proposing a single activity accessible for all. Furthermore, the practices embrace different artistic languages, taking into account that children develop themselves by combining their senses. This methodology has had significant dissemination through Caderno Brincar, the play journal in Portuguese, the main publication about the project. It was sent to all Brazilian municipal offices and had downloads from all regions of Brazil and 7 other countries. Also, it will soon be available in Spanish and English versions. Moreover, the methodology was adopted in the early childhood education curriculum of the city of São Paulo. To conclude this presentation, we will now exhibit a short video that provides a glimpse into the project activities. I hope that our experience may serve as proof of the fundamental importance of inclusive education. Thank you for your time and attention.
Projeto Brincar, Educação. É brincando que a criança aprende a inventar mundos. Por isso, toda criança precisa brincar.
Crianças pintam juntas um grande painel de plástico transparente.
Desde 2017, o Projeto Brincar propõe a criação e experimentação de práticas pedagógicas inclusivas na educação infantil, incentivando a realização de brincadeiras que envolvam todas as crianças, com e sem deficiência.
Diversas fotos de atividades do projeto com educadores e gestores. São palestras, visitas a museus e debates. As crianças pintando juntas.
Brincar, aprender e descobrir caminham juntos.
Marcele Barbosa é uma jovem mulher negra e é educadora na Rede Municipal de Ensino de São Paulo. Ela está em um grande pátio de escola infantil.
O projeto Brincar, eu acho que amplia a nossa mente em relação à educação infantil de fato.
Do planejamento às atividades, trabalhamos com os educadores, pesquisando, desenvolvendo materiais, experimentando e brincando.
Educadores participam de brincadeira coletiva, dançando sobre um grande papel com desenhos. Guaciara Labônia Guerreiro é uma mulher branca de cabelos longos. Ela é coordenadora do Projeto Brincar.
As diferenças das crianças não limitam as proposições dos educadores, né? Muito pelo contrário, elas abrem um mundo de possibilidades.
Suspensos sobre uma rede de tecido, crianças com e sem deficiência pintam um lençol branco que está no chão. Com a ajuda da educadora e de tecnologia assistiva, um menino com deficiência física joga bola com seus colegas de turma.
E para que todas as crianças com algum tipo de deficiência e sem deficiência possam estar juntas, a gente diversifica as práticas pedagógicas e acessibilizamos os materiais.
Bem que o passarinho queria perguntar: isso é o seu ninho? Ou você tem medo de voar?
Na tela, o texto da poesia em alto contraste e o intérprete de Libras. Sentados em roda sobre um amplo gramado, educadores debatem e compartilham experiências.
As ações envolvem crianças, educadores e famílias de diversas escolas de São Paulo.
Em sequência, fotos de brincadeiras e atividades na escola, envolvendo alunos, pais e educadores. Aldine Nogueira trabalha na formação de educadores para a educação inclusiva. Ela é uma mulher branca e está em um pátio de escola.
Teve esse aumento significativo de frequência dos pais aqui no ambiente escolar. A gente teve, num único dia, em torno de 500 pessoas.
Desde 2017, mais de 2.100 educadores de mais de 500 escolas foram formados, beneficiando 30 mil crianças.
Para mim é um desafio mesmo diário para poder incluir de verdade. É constante esse movimento de ação, reflexão e ação. Muito caminho pela frente, né, para melhorias em relação à garantia do direito de brincar de todas as crianças, mas muita conquista também já alcançada. O nosso papel é esse, de sempre procurar fazer o melhor por todas as crianças, todas brinquem juntas, né? E que seja para as crianças, sem diferenciar essa que tem deficiência e essa não.
Em uma montagem de teatro infantil na escola, as crianças com e sem deficiência performam personagens da história e brincam juntas.
Iniciativa: Fundação Grupo Volkswagen. Conhecimento que move pessoas. Parceiros: Mais Diferenças. Educação e cultura inclusivas. Cidade de São Paulo. Educação.
Thank you. Thank you.
Thank you, Carla and Daniela, for such a great presentation. It really shows when you have children engaged in play that they have fun, they have such a happy emotion. It helps them to learn and breeds, helps to grow their creativity and imagination and makes everyone happy. Without further ado, we'll go on to Veronica and Betty from Sightsavers, and they will be talking about improving early childhood development education for children with disabilities in Malawi, and how they've worked to change attitudes and provide support using the assets in the community.
Good afternoon, everyone. Thank you, moderator, for this opportunity. My name is Betty Moses, and my colleague Veronica from Malawi and UK, respectively, representing Sightsavers. Sightsavers works in 30 countries in Africa and Asia, and we work at regional, national, and local levels, where we aim to strengthen the existing systems. In our Leave No Child Behind project, we were working in Malawi in the rural areas, and the project was for 3 years. It was funded by Comic Relief. The project was being implemented in 20 community-based child care centers, locally known as CBCCs, and we were targeting or supporting about 179 children with disabilities. These are different types of disabilities. Our key activities in the project were training and sensitization of parents and preschool teachers, whom we also refer to as caregivers. We had also another activity which involved the resourcing of the provision of the assistive devices to the children and accessibility adaptation. All this was being done with local partners. Ladies and gentlemen, I would like to show you a video for more insights and impacts of the project. Thank you.
Disabilities are associated with a lot of stigma, and we have stories when the mothers or the guardians could not even take their children out of their houses because they were so ashamed or they were so embarrassed.
Piwa wakaenda asola katobwera kuno ndiye kinakana pabwera tinali mpikisa tumisanyana tufunana waulumali
nalibe nzeri mene nzeri ndaipeza wobira kwa chimpambana maswera akha kuvina akalamba kuvina mabi kwangomugwira chonchi ayeso amalumpha amasirira kwambiri
oyambirira ndisinapita kumaphunziro mangophunzitsa ana alungalunga koma ana ulumala nimaona ngati kapena alibe ntchito kwa ine koma nditapita kumaphunziro Sightsavers nditenga kupita kumaphunziro nandiphunzitsanso kuna kuti ana ulumala nawo fanya kutenga nawo mbali ndi chifukwa ndaphunzira kaphunziro ka ana ulumala nditabwera kunoko ndatenga ana ulumala ndi alungalunga nkwaika limodzi kukaphunzitsira.
koma mmene mwayambayo kupita kumeneko poona anzacho ndi pamene akutambasuka akupita nayenso nasewera nadziwa chifukwa cha kumeneko.
Koma chakwera center ana kutenga buka ku primary ana aulumali akukhala magulu kupanga nawo zimodzi kuti alungalunga kasinga ndithu setamene.
It is not easy for people to change their perception. It is something which takes time. Gradually, we are seeing positive change.
We need to make more noise that disability is not inability. We need to make more noise, and with noise, we'll get there.
So the project was innovative in very many ways. Our biggest aim was to make it a locally owned model of disability inclusion. We worked with existing systems, with key traditional leaders, everybody that we thought was really important to back us and to start to understand the importance of inclusive education. Some project-specific things that we did were to produce materials in local language, very well illustrated, and these carry messages about inclusion. So calendars and a training flip chart for use by the voluntary teachers who are known as caregivers in Malawi. Also, an important strand has been advocacy, but also some training materials which are now being delivered at national level in the training for these preschool teachers. Impact, I think the film explains on its own what the impact was, but this was a comment from a ministry official and just saying that the centres have transformed my thinking about ECD and how we are implementing our policies. And through ECD networks, we're able to carry that message and to show what can be done in low-cost ways. That's our big issue, is how can you do things without incurring massive costs? Challenges, and I think you'll all be familiar with these challenges. As we say, low government investment in ECD, weakness of existing systems, and a big issue for us was the weak links between education and health systems. So we did work with government extension workers and health surveillance assistants to find information and strengthen those links. Food shortages, drought, poverty, very big challenges. The provision of food is one of the key things that attracts young children to the centres, and when food shortages hit, that becomes a real challenge. Also a limited understanding of child rights, and that's something else that through our training we try to address and explain and try to help communities to understand that education is a right. Sustainability, always a challenge. You know, what happens when we leave and the money goes. So the way that we've addressed some of this, the future of the project, we have managed to secure some additional funding and have changed. Sorry, I've just noticed my time's up. We've introduced a livelihoods component. So I'm getting very funny signs. I've got one more minute. More focused use of materials, managing behaviour change. So what do we actually want to change? So we're not just doing everything and see, we're actually trying to measure what works, and managing effective scale-up. And scale-up, of course, is a big issue for us. So finally, scaling and replicating increased use and continuing use of advocacy, just the push to say that all ECD activities must include children with disabilities, Looking at what the key factors are in sustainability, we do have a research part to our project, and that has examined some of these factors. And then just staying in touch with the existing ECD networks and making sure that our messages about inclusion are on agendas where they should be. I think that's us.
Thank you, Veronica and Betty. I'm a big fan of this project, and I'm certain we're going to see great learning outcomes and of the students who have been enrolled there. I'm certain we're going to see those positive effects. The next. Our next presentation is from Poonum on inclusive childhood education and care in the slums of Nairobi. So the intention of this project was to improve retention and access to early childhood education in the slums by supporting teachers and parents with training. So I'm over to Poonum.
Habari everybody, servus, and good afternoon. I don't have a video to show you, so you're going to have to listen to my voice for the entire 8 minutes. My name is Poonum Wilkhu, and I'm the chair of the board of directors at the Action Foundation Kenya. We are a youth-led NGO supporting children with intellectual and disability and physical disabilities and their families. The image you see on your right is our office and our resource hub. It's based in the Kibera slums. Kibera is known to be the largest slum in the entire continent of Africa, with a population of more than 1 million. The number is actually contentious, so we'll leave it as more than 1 million. The beautiful lady you're looking at here is Maria Umare, who founded the Action Foundation Kenya in 2008. There is an inspiring story behind our humble beginnings, so I would like to invite you to our website to read more about that. So you're probably wondering what we do in this ramshackle tin building. Quite a lot, actually. We run 3 main programs, as well as the economic empowerment program called Initiative. It's an initiative called PAR. I'll be going through our Somesha initiative program, which means inclusive education, very shortly. Under the Tunza program, which is health and well-being, we ensure that our children get at least 1 nutritious meal a day. They receive occupational therapy, rehabilitation therapy, medical assessments, referrals, and psychosocial support. The parents as well are given training on how to care for and engage with their children. Under the Ibuka program, which means women and girl empowerment, we talk about gender-based violence, sexual and reproductive rights, and we distribute dignity kits and much more. As you can expect, in the slum areas, this is a very big problem. Just to give you a bit of a background, even though the Constitution of the Kenya Article 54, 1B, states that a person with disability is entitled to access educational institutions and facilities, most schools are simply not equipped to accommodate children with disabilities. Approximately 100,000 children with disabilities are out of school in Kenya, and 31% of them have multiple disabilities. So what gaps did we find? Specifically in the slum communities, there was low enrollment, low retention, and poor transition of children from preschool into primary school. Why? Because of stigma, discrimination, lack of skilled teachers, and inadequate resources. So we set a goal to ensure that every child with disability had the opportunity to enroll into holistic education programs. In 2015, we had 16 volunteer special needs teachers who went out into schools and they worked alongside the teachers. We managed to train 240 teachers, 800 caregivers, and 21 heads of school between 2015 and 2019. So what were the interventions? They included demystifying myths such as disability is contagious, disability is a curse. We trained teachers how to use assistive technology. We supported children with disabilities through the use of individualized education plans. One size simply does not fit all. We also promoted peer-to-peer learning, similar to what Malawi did and Mais Diferenças. So working with children and children without disabilities working together. We also supported and signposted parents to resources that match specific to the children's needs. There's so much information out there that parents with children with disabilities simply cannot access, probably because of poor literacy and many other reasons, and we facilitate this process. I'm proud to say that we started off in Kibera, and due to the success we had there, we have been able to roll out to 2 other informal settlements in Mukuru and Kawangware. our impact so far. So we've reached 1,600 children with and without disabilities. And of the 240 teachers that we trained, 56 have been recruited to train other teachers. We have improved enrollment from 25 to 55%, which is a fantastic achievement. During this time, we also refined our toolkit and our digital platform called the Somesha app. This is a knowledge hub for teachers, and it has many functions. It's a best practice sharing forum, it's a resource for guidelines and articles, and it's also a platform to connect with fellow teachers. So we're looking for partners. If you're interested, please feel free to approach me after this. Through this program, we also promoted socio-emotional learning through play, drama, and creative arts, which is quite unusual for our rigid curriculum system. So why have we been so successful? Because we had special needs teacher volunteers who were willing to go out and share their expertise. We were able to invest in much needed infrastructure and materials. And where possible, we engaged with networks and stakeholders. We worked very hard to rebuild the trust between parents and teachers, very similar to what Malawi found there. We trained teachers to provide individualized teaching, and we ensured that the community were aware of what we were trying to achieve. It was important for them to see and participate in the children's successes. And this is an important step in breaking down the community barriers and the stigma and the discrimination towards children with disabilities. Also, having fellow classmates being mindful of and supporting their peers with disabilities was a major key player in the project. Finally, having a thorough baseline assessment, but not at individual, not at just classroom, but school and community level was very key. Like every other NGO I've been listening to yesterday and today, yes, it comes as no surprise, finances are a big challenge. The success of this program has been made possible by our donors, and we're very grateful for that. Other challenges were human resources, lack of materials, the school timetable changed, so last minute we had to shift our program to match that. We had parents who were unable to pay school fees, but we worked around that too. The program is sustainable, mainly because we have parents who are completely engaged with what we're doing. And there's ownership of the project by the teachers and because of our advocacy work. We have a very rigid national curriculum that makes provision of individualized teaching very difficult for the teachers, which is why, as next steps, we're going to advocate for inclusive education at national policy level. We also plan to scale teacher training, and we want to foster strategic partnerships. Please do come and speak to me if you find our projects of interest to you. And we plan to mobilize the resources to expand training program to other ECD centers. We are a small organization, but with incredible drive and energy, and we have a vision to improve the lives of children with disabilities living in slums. And with that, I would like to say Asante Sana from all our children and all of us at the Action Foundation Kenya. Thank you very much.
Thank you, Poonum. I must tell you, I met Maria last year in Cali. She is a young, enthusiastic person, so infectious. I can see exactly why this program is thriving. It's just sheer passion and energy. It's a fantastic program. Thank you for that. Next is, we're going to India now with our colleague Rajeshwaran, who will be talking about their program on inclusive education and support for children with disabilities.
That's okay.
Good afternoon to all our friends, ladies and gentlemen of this wonderful auditorium. I am Rajeshwaran Senthilnathan from Amar Seva Sangam. We are from India. As a non-profit organization, we are doing early intervention therapy for children with delayed development. Amar Seva Sangam is a premier organization in the field of disability management focusing on rural areas, which is established and run by two gentlemen in the wheelchair with the mission of creating a model valley for the disabled. Mr. Yash Ramakrishnan is a founder, president, and engineer, and Mr. S. Shankara is a chartered accountant and secretary of our organization. Both are all the wheelchair users affected by spinal cord injury and muscular dystrophy. As a rehabilitation unit, we are providing a medical, educational, economic, and social rehabilitation for integrating the disabled individuals with the society for their improved living conditions. In current scenario, the child disability is a global health issue. Globally, more than 52 million children under the age of 0 to 5 are suffering with development delays. In India, it is more than 12 million. This is a very huge amount. As per the WHO context, the early intervention is the only one solution for the child disabilities and improve their school enrollment. But reaching the children with early intervention program is a big challenge because of lack of awareness, access to specialists, and geographical accessibilities, of course, financial needs. Based on our long-term journey in this rehabilitation area, we have developed a solution for this early intervention. Along with, we designed an innovative technology called MVBREI, a mobile-based and web-based technology. We named it as Mobile Village-Based Rehabilitation Early Intervention. With this application, the mobile application, we can do an awareness program and screening, and also we can give the treatments to the children at their doorsteps. And finally, the most important one, it will be a robust real-time monitoring system. It is most important one, With this support of this application, the user can retrieve and upload the data, and henceforth, it can be accessible at anywhere, at any time with the GPS technology. With this technology, this is the process flow of our program. Initially, the awareness will be created and screening will be done at every primary health centers, schools and villages and communities, and once they are identified, they are coming as a baseline records. We can create it in the baseline records and we can do the assessment, and the treatments will be fixed as per the conditions of the disability children. And also we can provide the treatments in the doorsteps, and finally we can do the evaluation and to monitoring the development of the kids. And at the same time, we can also monitor the execution of the efficiency of the program in the field. This technology-leveraged home-based rehabilitation program, these are all the highlights we got. Nearly 40,500 children are screened, and more than 40,000 people are awareness provided in this program. And more than 1,200 kids are rehabilitated. And these are all our key results. The most important one is high engagement with 87% of visit compliances. And the big impact is increased school enrollment from 55% to 75%. And also the decrease of caregiver strain up to 74%. And we are all in the field, and the short-term goals we have to screen more than 1 lakh of children and do the partnership with public and private fundings. And this program will come out the cost per child per annum up to $286 US, which is a very economic rehabilitation program. And long term, we are looking forward to board with NGOs to cover this program in the entire state. And here, for the Zero project can help us to funding for the further scale up, enhancing our knowledge, and we want to establish a training and research center for these kind of early intervention program, and also taking these models in national and global level. And next, we are providing and showing a video about our early intervention program.
Intervention involves early identification of children with delayed development and intervention through a focused, evidence-based treatment program to prevent disabilities and maximize a child's future outcome. Our program includes regular physiotherapy, occupational therapy, speech therapy, and special education. Early intervention has been proven to positively impact gross motor, fine motor, communication, cognition, and occupational function in children affected by cerebral palsy, autism, and other causes of delayed development. Community rehab workers, guided and monitored closely by rehab specialists, provide therapy through joint visits and ongoing communication. As part of this program, Handicare International and Amar Seva Sangam developed a digital health solution called Mobile Village-Based Rehabilitation Initiative, or MVBRI. The application allows for community rehabilitation workers to track the progress of children and allow rehabilitation specialists to guide therapy by setting goals, treatment, and exercise protocols and schedules. The MVBRI application allows for real-time decision-making for assessments, treatment planning, implementation, and evaluation. This model is likely to be a world leader in the future.
And this is a comprehensive and end-to-end solution for these early intervention issues. Here's the child who are rehabilitated and going to school now. Finally, disability is not a constraint, it's just a condition which we can overcome. Thank you for all.
Thank you, Rajeshwaran. That is such a fantastic presentation. I really, sorry? No, not done. You're done. Yes. Fantastic presentation. I think when you track a child's development like that and you can show it visually to a parent from where a child was and where they are now, it really motivates them and it really shows them what the child can do and their abilities. So I think it's a really wonderful approach. Thank you. Next on our list of esteemed colleagues is Maria, who will be talking about inclusive early childhood centers and how they've been developing, looking at how they can improve referral and support to children in all areas of development.
Hello. In behalf of NIP, we thank Zero Project for the opportunity and you for being here and your attention. The National Institute of Comprehensive Early Childhood Care launched programs to introduce early childhood care centers for children with and without disabilities from 45 days to 5 years old. There are 641 centers through the Dominican Republic with around 195,000 kids serviced and 153,000 families as part of our programs. In this video, you're gonna look at the representative actions of the components of special needs and the attention. won't work. El componente de detección, atención de necesidades educativas especiales y discapacidad se encarga de identificar y referir a los niños de 0 a 5 años a espacios donde reciban atención terapéutica, ya que en INAIPI no damos diagnóstico ni hacemos terapia. Gracias a nuestras instituciones socias podemos hacer el referimiento terapéutico a los niños oportuno para que reciban la atención necesaria según su condición. Las agentes de salud emocional son las que realizan los informes con el fin de ver si es necesario realizar una visita técnica y también poder referir a los niños al espacio donde puedan recibir la atención terapéutica. Cuando se identifica que es necesaria una visita técnica, la técnico nacional asiste al centro, da las orientaciones necesarias para que el niño esté incluido 100% como cualquier otro niño sin condición de discapacidad o señal de alerta. De este modo se hacen las mismas actividades, lo importante es que el niño esté 100% incluido y esté feliz disfrutando en su plenitud de todos los servicios que ofrece el INAIPI. It's not working. Okay. The next one. Okay. So in the innovative aspects is the first state policy aimed to integral attention and early childhood. The 641 centers provide education, health, nutrition services, as well as assistance to the family who received the training to improve their skills in the child care. The model of integral attention foresees 6 components for successful and effective early childhood intervention. They are part of the multidisciplinary attention that is divided in early childhood, health and nutrition, birth certificates, families and community participation, protection and abuse prevention, and special needs and attention. Okay. The impact created, the children attend to early childhood care centers 8 hours per day, Monday to Fridays, 11 months of the year. There is a transitional protocol for children that are entering to primary schools, and whereby they're supervised for a year and ensure their support and the inclusion the whole time in the next grade they are going. Since 2015, more than 175,000 children have been enrolled, and 1,144 children with disability have received the support during 2019. This is, in the next video, you will find the story of Christian. He's one of our children, and the story is told by his grandmother that he's treated like a prince, and it has all the multidisciplinary services integrated for his attention. Thank you.
A lo primero, yo le voy a hablar la realidad, que ahí está la doña de testigo. Yo no quería, porque hacer un niño así, y yo le decía a ella, donde hay tantos niños, que él estaba en Verón, un niño así no lo van a atender, pero es mentira. Los niños así lo atienden mejores, le dan más cariño y más amor que a los que están. Pero cómo decirle que en ese centro no hay discriminación. Al contrario, lo tratan mejor, vuelvo y le digo, a todos lo tratan bien, pero para esos niños hay un cariño en especial. Le dan más cariño y más amor y más tendencia. Y yo me siento muy contento y muy orgulloso con ustedes y espero que sigan haciendo esta obra y que Dios me lo ayude cada día más.
Next, please. Okay. The financing and sustainability, INAIPI has an annual budget assigned by the Ministry of Education. In 2019, the budget for annual operating and purchasing plans was around 97 million of US dollars. To enforce the policy, there are regular visits to check in IP centers and to the parents. The Institute enforces permanent awareness training campaigns by the national technician and the emotional health agent for its personnel to keep them up to date most of the recent developments in childhood care. The challenges, a national therapeutic coverage, the lack of a specialist trained in the area, lack of awareness, fear and ignorance of the family and also of the community, the follow-up on the parties involved, the kids, and the therapeutical attention, and also the family, and the unification of the referrals and treatment between specialists. Here, okay. Here you have an example of 3 of our children having their activities at the patio and other place. Okay. I need the last one. I'm not clicking it. Okay. Yes, please. So the next steps for the project are to increase the coverage nationwide for the services provided, to ensure the proper implementation of inclusive practices in every center around the country through the knowledges provided to our staff, and in IP plans to improve the program by maintaining the expanding agreements with other organizations who provide the specialized care, and to the further training of the staff to identify the support children with disabilities and their families. Thank you very much.
Thank you, Maria. That is really interesting how you focus solely on the very, very young children and could do so much. And this is the key, because 80 is too late. You have to focus on the youngest of children at the earliest point you can to be able to reverse any disabling effects of a condition and to help them develop to their best potential. Our next speaker is Susanna from Armenia.
Take it with me.
And she will be talking about the early childhood and preschool programs they started there to help with transitioning from home to school.
Okay, thank you very much. In a very short period of time, I will try to present a project that really made a huge impact in my country. Overall, inclusive education as a state policy started in Armenia since 2005, and already the country has commitment that the system of secondary education will become total inclusive by 2025, and already we are on the halfway of this process, but we faced a huge gap when having a preschool education system still non-inclusive, which is not acceptable thing. So should I?
This one.
This one?
Not working. The other one.
The other side.
Okay.
And it became a subject for discussion with different stakeholders, families, educators, and in order to come up to an idea, in 2015, Bridge of Hope conducted a research. It was education transition for children with disabilities in Armenia. And we consider the research to be a really very valuable opportunity to investigate very important stages for child development and their transition between education levels. And actually, this was a topic for the first time to be tackled in the country and became to be really very important. The key findings of this research showed that information about the child's development and performance and about the methods for working effectively with the child is not being transferred with the child between different education levels. And overall, the transition was not seen as important topic, while it has real, very big impact on the success of the child in different stages of his or her education. And all the participants of the research reported the importance of having preschool education to become inclusive on the one hand, and also the preschool institutions to have a person responsible for coordination and communication of child's strengths, development opportunities with parents, and also with the primary school that the child was going to be to attend after the preschool education. And it was just the time when the Committee on the UN CRPD was preparing general comments for the state parties to become more effective, meet the requirements of Article 24, and we submitted this research report to the committee, and are really proud for this success, that the transition as a very important aspect was accepted by the Committee of UNCRPD, and now is like a requirement for the countries to look also at a transition aspect for better inclusion of children. Actually, the project, the other one?
If it works. No.
No. It's not working. Okay, great. So the project targeted 24 or 23 kindergartens and 28 primary schools, and all teachers, 234 preschool and primary school teachers have been trained in different aspects in inclusive education, and training has been conducted in cooperation with Step by Step Foundation in Armenia. And teachers have been trained, and it was not only theoretical training, but also they have mentor teachers who then provided hands-on support, whatever they have learned, to practice in the classroom together, to work how to do person-centered planning, develop individual education plans for child development and education. Also, the teachers have been trained on transition aspects, and for this purpose, we have an expert from the University of Edinburgh, Juliet Tancock, who contributed a lot in building the capacity of teachers to become actors and key players, making the child's transition free of stress or smooth to primary school level. Also, 145 parents have been trained in the same aspects. That what is very, very important, it was to convince the parents in their to recognize their importance of their role, in not only in organizing the education of the child, but also supporting the child to experience a smooth transition to the next level of education. It was a pilot initiative, and we're happy that all parties, teachers, parents, and also the mentors were working collaboratively to achieve the outcomes of the project. And the learning we have gained with our experts and the practice as well, a transition guideline for smooth transition from pre to primary school has been developed that is available also in English in our website. And it gave a very easy to use strategies, helping teachers, parents, and those who are interested in promoting inclusive preschool education in the country to use it and to support the smooth transition of children to primary school level. It was like suggesting strategy for about 8 to 9 months, 6 months to be realized at preschool and 3 months in primary school. And that's it. Yeah. And together, parents and teachers have developed the individual transition plans, and during this period of months, these transition plans have been realized, and children experience smooth transition to the next level of education. The next biggest outcome of the project was the decision to target the pedagogical university of the country, because if we want real sustainability, then future teachers should be prepared for better inclusion. And the chair of preschool pedagogy of the university, 13 professors have been trained by our experts from the University of Edinburgh in inclusive pedagogy principles to be ready to educate for every child and to meet the diversity within the inclusive group. And the trained professors have then reviewed their teaching courses using the principles and strategies of inclusive pedagogy, and also applying the strategies for smooth transition in their training courses. Innovative aspect, whatever I have told, it was the key innovative aspect for the project to see inclusion, transition as precondition for better inclusion, and that it is already part of teachers' initial education program. And as for the impact, already these kindergartens are like role models for other kindergartens, and my time is eating this device, by the way. Teachers, all the teachers and parents then reported on a positive transition for their kids in the kindergarten, and they are happy with the success kids are doing at kindergartens. And the last one, all this concept has been then incorporated in the legal framework of the country. The project supported to also make significant changes in the law about preschool education, and already the first reading in the parliament has been passed, where inclusive preschool education is stated as another key direction for state policy, and also smooth transition is strengthened not only by the law, but also it already is part of preschool education curriculum. So, and the success, when we were conducted the case studies, one of the parents says, the biggest success for my family is that my son has the sense of belonging. He belongs to the group at school, which is very important, and this is the best, maybe, evaluation of our project. Thank you very much. If you are interested, you may attend our website, and this okay. Yeah, I want just to show our website. You may contact us, and we have huge experience that we can share with you all. Thank you.
Thank you, Susanna. And it's so important we give children that sense of belonging as soon as they are in a group with other children in a classroom when they first enter the schools, because enter a school setting, because everyone belongs. I heard some, I know some good news. I think your program is going to be featured in a film by ENET, Enabling Education Network. So, and they're developing also a module linked to the film to inspire other countries to also follow a similar model. Great work. So our next presenter is Annie.
Is it me?
Yeah? Yes.
Finally.
Finally. It was, Annie, she was quite concerned that she was last, because alphabetical Annies are always first, right? So Annie from Jordan will present now her program on the approaches to ensure success on inclusive education in the early years.
Yes, hello, my name is Annie Medzegopian, and I run a Center for Disabilities, which has been established by Her Royal Highness Princess Majda Raad since 1971. So I'm not talking about the successful inclusive education, I'm talking about informal education, that in preparation for a successful inclusion. So I know that my colleagues, they have been referring about early intervention, but for us, early intervention is from day one, which because it's not 8 is too late, they say, but no, 4 is too late. So day one, this is what we try to encourage it, and we involve the parents in providing comprehensive rehab services. So speaking about as I said, Hussein Society was established in 1971 by Her Royal Highness to provide comprehensive rehab services for people with disabilities in general and children with physical disabilities in specific. At present, we reached over 4,000 people with disabilities at the national level, including the refugee camps, okay? But today I'm going to limit I just want to share a very simple program with you, and I wish I had the time to share all our experiences. It's about, it's not, as I said, it's about preschool skills class. It's not a class, it's an informal. What happened in 2009, according to the rules and regulations of the Ministry of Education, we had to ensure that our children, they have the IQ test that can fit them to be able to understand and cope with the curriculum of the Ministry of Education. Okay? So what happened, the multidisciplinary team, which consists of physiotherapists, occupational therapists, special educator, speech therapist, they came to me and they said into that, Annie, no one passed the test. Okay? No one passed the test. I said, but why? He said, only those who attended our early intervention program was able to pass the test, and they were able to be included into the mainstream schools. I said, okay, where were those people who came? They said they were in their houses. I said, how do you expect to assess a child performance based on, who are isolated, totally isolated in their houses, and we want to really evaluate them? So I said, why not to give them the same chance we have given them for the early intervention program? So we enrolled them in a class. It's not without even telling the Ministry of Education. I did not follow the rules and regulations. So we opened a special class, and we called it preschool class. It's not an informal. And we started, dealing with these children, providing them, and we had to really, notify the parents. I said, don't expect your child to go to the mainstream schools. Okay, please, but if you want them, you need to be our partners. If you are not partnering with us with these experiences, it will fail, totally failure. But it was really beautiful experiences. Of course, we had a very intensive intervention. From my experience, you cannot start inclusion from the beginning. They need to have intensive intervention to empower them to identify their potentials, getting ready. I know it is a controversial thing, but as early as we start, as early we can integrate them. Because what we have found, those children who attend our early intervention program are easily integrated into mainstream schools, but not those who come directly from the homes. So thanks God. And yes, the essence, as I said, who are not exposed. And the problem is, in Jordan, we assess the children with 1 or 2 sessions, for God's sake. You are deciding the future of this person, of this child, from 1 session and 2 sessions. Give him a chance. Let him identify. So that's why we spent 1 year together with the child, with all the multidisciplinary team, applying the interdisciplinary approach and not the intra. We intra that all the disciplines, they assess together, they plan together, they implement together, they reassess together. So this was working together, and this was very essential. So we could see a really good, the impact created. I cannot say that we have created an impact. Impact needs a lot, 10 years to go, to see. Our only indicators was that 77% of the children who attended the class were able to go to the mainstream schools. But to what extent they continued their education, nobody knows. Because there is no follow-up between us and the Ministry of Education. There is no follow-up system that will help us know exactly what happened. Dropout is the main indicator. It's not, as I said, we cannot just upload and say, oh, we are doing a great job. We are not doing a great job. We are on our way to do a good job, yes. So creating inclusive community where every person enjoys quality of life, apply equity in providing equal opportunities. I always believe equity versus equality. If you want to really, achieve equality, you can only do that by providing equity. And equity means that you have to deal with every person, disregarding. And this is what happens at our early intervention. We never classify the child. We only deal with the symptoms and to empower them until then he can prove himself. So equity is providing the needs of every person, disregarding his or her needs, okay? So the impact rate, I just want to give you one simple example. My God, we had a child who joined the early intervention, and then joined totally different. I mean, you should have seen, totally. If you first see the child, you can say, no, this child, no, he needs intensive care. But the moment you open the door, you can find potentials. Okay, so the success factor details, as I said, 111 children enrolled to the program, and 77 of them were admitted to 77. Still, it's not enough. Where are the 30%? I mean, I'm not saying that we could have, but you know that those who failed, their parents were not that much cooperative, by the way. I cannot blame them. They have other, responsibilities. But we need partnership, a strong partnership between the service providers, the parents, policymakers, and plus the child, the most important thing. As you can see, we integrate them in different school settings, public school setting, inclusive school setting, and even the private setting. Financing, of course, as my colleague said, partnership. The financing, we don't have. The problem is we have to allocate $1.5 million per year to be able to survive, okay? Our government gives us 5% of our, 5%, which is around $100,000, okay, per year, while we have to allocate the rest. Sustainability, we want to present a model for others to follow, incorporating with the Ministry of Education. Challenges, lack of qualified specialized in music therapy. Without saying that, we give them music therapy, hydrotherapy, of course, even hippotherapy, hypnotherapy, all kind of services that, okay, I'm just okay. So, and an assistive budget not allocated to the ministry to cover the comprehensive rehab services. The next steps, develop training packages covering all the aspects of the applied innovative approach. We're doing it, and to tell, we at the Hussein Society, we don't believe that we have to export things from outside. We are, finding it ourselves. We are creating our own training packages. We are training our own approaches and putting them into practice and in coordination with the universities. Okay, and we're doing a case studies just to make its evidence-based practices in order, because there is no training without evidence. Integrate the program into the HS programs to become one of the main components of a strategy to become regional training center. Finito. I just want to, this is the, so I'm just, I'll give you some small pictures, as I said, about one of our, can we share that, please? Okay. I need therapy. It's okay. I have the best accused nowadays, c'est l'âge, the age. Getting older is becoming really good for me. Come on, where's the, yep. Come, yeah, because, you see, I was very, as Susanna said, I mean, this machine is burning our time.
It's the last slide, right?
It's not slide, there's a video.
Oh, it's a video. It's the video.
Homemade video, by the way. We don't have money like some of the colleagues I'm into. It's very simple, homemade money. Yes, I have. It's not, I sent it. I sent it, wallah. I don't want to waste your time, okay? I do have a lot of videos. I have one very special case study, okay? Huh? I will tell you the story, okay?
Go for it.
Okay. Can I stand?
Yeah, you can stand. Go for it.
Okay, what I'm saying that we had a child that enrolled this session, and her name is Safiya. Safiya, she had this quadriplegia, very severe disabilities, okay? And Safiya, nobody accepted Safiya. If you see Safiya with her spastic, and you can say, oh, this child, you know, this is for the community. If you say persons with disabilities, they are persons with intellectual disabilities. They are contagious, and they are, what happened, we accepted and we used assistive technology in this class. Now Safiya, she's now 18 years old, and she's passed the college, and this is the best best indicator, the continuation of the studies, and she wanted to be IT. By the way, it was her choice. I remember Safiya, when she was only 5, she started criticizing the teachers, and I loved it. I said, this is the lady that will make a change. So thank you, dear. And what?
Oh. Annie, your passion. Oh, I love it.
You haven't seen Shwai, you only see Shwai.
Oh, we only see a snapshot now. And I tell you that fire burns in all of the people here on the stage, and we want the fire to burn in you too. That's the thing. Early childhood intervention, early childhood development is critical for inclusive education. We are going to, and then successful inclusive education. This is what is going to revolutionize our sector. And the thing is that people don't know it. And, you know, we're at the stage in the world at the moment where governments are thinking about early childhood development. It's in our Sustainable Development Goal Target 4.2 to have early childhood care and education. It is there. But we need, and there's also the research that shows that if you invest in it now, there is a massive return for economies, but more so for individuals to have a good life, successful lives, being able to go through school, primary school, high school, university, have great careers. Success is in the individual success.
Yeah,
and
I wish I show you Safiya, for God's sake.
Oh, yeah. But I can tell you that for me, I have a disability, and my friends who have disabilities as well, who are, I guess, deemed successful, we had good early intervention. And it might not have been with fancy therapists and things like that. It was just parents who played with us, believed with us, wanted to develop our skills. So I think that is honestly the key. So we want to start a revolution here. This was our plan. And we want you to all join in our revolution and call on world leaders to invest more in inclusive early childhood development. This is what we need. We want world leaders to invest more in inclusive early childhood development. So we have a petition going with Global Citizen and all these other partners like the Early Childhood Action Network. You can take a photo of the QR code, or if you have a QR code reader, and sign our petition. They gave us a target of 30,000 signatures. I hope we can maybe reach it by tomorrow. Maybe it will be really good to show people that this is important, and call on world leaders to say, put your money where your mouths are. If you say this is important for human capital development, invest now. It's not just necessary for children with disabilities, it's for all children. A child who experiences trauma and war times, a child who is hungry and is malnourished, all of them need early childhood intervention to be able to develop to their full potential. So please join our revolution and movement and call, and that's my appeal to you. I don't know, do we have more time?
Do we have more? Yeah.
Do we have more time? Yes?
Can I share with you a singer,
Yes, go for it.
No, I just want to put there.
Okay, go for it.
Go for it? Yes.
Okay. Do you have any questions for our panel? Shall we take a question or comment? Okay, right at the back there. I can see that.
Thank you so much. Let me declare a conflict of interest. I'm also leading an organization that is supporting early childhood development. And my question is that how do we reach the poor and the marginalized children, particularly in rural areas? And how do we ensure that they have access to quality social services, including early childhood education? Thank you.
Who from our panel would like to take that?
I can start. I'm happy to start.
Okay.
So I'm not sure if you noticed that we are actually based in the slums. Our offices and our resource hub is in the slums. So if you're where the need is, then it's very easy to then reach out and do a baseline assessment. So having a baseline assessment is also very, very important. The third point I want to make is not only just location, but reaching out, but also you need to keep on knocking. knocking on doors and being persistent until somebody opens it. So it's a case of being persistent, really, and placing yourself.
Don't expect
and doing
it. I mean, just push with your...
and doing a very thorough baseline assessment of where you want to be, where the gaps are, and what you need to achieve, what your current resources are, and what you need to get to your endpoint goal. Does that help?
Carla, you also wanted to add? Oh, Susanna, sorry.
Thank you for the question. It's really a big challenge for many developing countries, especially for my country, Armenia. The accessibility of or early childhood programs or pre-school education institutions, especially in rural and remote areas. And this is not only a challenge for the specific countries, this should be a challenge for many bilateral international donors to support the countries, because this is a very critical stage in education that should become really not only inclusive in certain places, but totally 100% accessible for all children, including those who are from poor families, from refugee families, disability. It doesn't matter. They should be inclusive, affordable, and accessible, and should become top on the agenda, not only for the government, but also those international organizations that are supporting the government to achieve sustainable development in the country. Thank you.
Can we have one more, Maria?
All of our 641 centers are located in prioritized areas for the special project of the government because of its vulnerability. So they're located in very, very extreme poor areas of the whole country.
And I think, Rajeshwaran, you wanted to also comment, right?
Yeah. In our program in rural villages in India, what we are doing is we just get connected with our primary health center, like an Anganwadis and primary schools. And in our program, we are doing like this. We are doing the screening program and every week, so that we can easily identify the kids, the newborn kids, who are all facing these kind of difficulties. As Poonum said, and another one way, we have to go every doorsteps. Yeah.
Okay. Do we have another question? Okay. This side? Do you need a microphone? Oh.
Is question from Montenegro to Armenia. We have, how to say, very official program for transition of children from preschool to the elementary school, and we are still faced with some challenges such as parents' decision to delay introduction to the elementary school. How you deal with that?
Thank you, very important question. Actually, working with parents is very, very important, and being an disability rights organizations, we know how to work with parents. We have a big, very well-educated and prepared group of active parents who provide parent-to-parent support and use their own experience and tell them their own stories, how it helped their children. This is quite widely spread phenomenon, especially in case of children with disabilities who are with cerebral palsy, or because every parent has a hope that, okay, we can delay and spend this year for rehabilitation of the child. And we are not to be blamed the parents, it's lack of information. So it is very important to connect the families with each other, to inspire each other with success stories, because most of all, parents want their kids to be developed and to be part of a whole. So they need support. And we, as an organization, use not only just the resource of professionals, because every parent will say, oh, you don't understand what I feel as a parent of a child with disability. But when you use the resource of other parents and families, they are source for inspiration for other families. Thank you.
Thank you. Do we have another one?
Add something. I just would like to add a comment related to the challenges we all face, meaning financing our projects.
Okay, okay.
I think that training the ones that choose what to finance is very important. I'm in an educational journey, as I'm not from the educational world, but in order to better finance and to better choose what are the projects with really good and big impact, and like, for instance, learning that the early intervention is what has to be funded. We are here, I'm here as a foundation to learn and to tell all the ones that have money need to learn much more on what they are financing. So this is something that really can trigger the way of the right financing.
I completely agree with you, Daniela. And one of the reasons that Light for the World, in partnership with other organizations, we're finalizing our research, and we've actually already started a lot of that. We will launch the research report now in June. We've looked at the funding levels of some of the biggest donors to early childhood development and see to what extent have their programs been disability inclusive as well. And then also deep dive into some of the low-income countries to see to what extent are they actually funding early child development and early childhood education. And it's shocking. It is absolutely shocking. So we have a report, a summary report, and we also have donor profiles for like USAID, for France, Germany, all of the different countries, bilaterals and multilateral donors. And this is, our aim is also to develop a tool to give them guidance on what is inclusive early childhood development, right?
To define the early intervention program.
Yeah. And that we should do too. Define an early intervention program. So we're on the road because it's training those people who fund it and explain to them how to do it and why it's so, so important. Do we have another question? Right at the back? Yes, I think it's...
Hello.
Sorry.
Hi. Nafisa, it's Rosa from Northeast India. I'd just like to ask clarity actually from Dominican Republic. You said that you have 8 hours of therapy in a day for children. So what actually do you do 8 hours with children? And just to have clarity on my part, what is the actual recommended hours for an early intervention?
It's not 8 hours of therapy. They go to the center and they have all the activities of early stimulation. And also we refer them to the places that they receive the therapy. So it's just education and inclusive center. We don't give 8 hours of therapy.
Okay, now if any one of you can tell me what is the actual recommended hours of intervention, because we have just started an early intervention center in the school, and I've seen that parents they take their child from doctor to doctor, therapist to therapist, from morning till noon till night. So, I mean, this is very exhaustive for the parents as well as for the child. So what is the actual recommended numbers of hours for intervention so that we can talk to the parents?
Yeah, I think for this question, Mr. Shankar Sagairaj, who is our colleague, has come along with us. He is a master's in physio and has a very good experience in physiotherapy for the child. He can explain that.
Hello. And the reviews are giving half an hour for any domain. Like if you want to give for a physiotherapy session, you can go for half an hour. And the next one is in alternative days you can give, because the brain is also having fatigability. So if you are providing daily or longer than more than half an hour, the brain will become fatigued and it won't learn. So the learning is very important. Better half an hour. Thank you.
I can just add to that is the idea with early intervention, you must build it into the daily routine of a family or a parent. So the parent will get ideally it's you'll do intense maybe therapy with the child in a session with the parent observing, and then they can just do it when they're massaging their child after they've bathed them, or while they're bathing them, they can do activities, cooking. So there's different ways to stimulate the child using your daily routine, talking to them more. So I think that when it comes to how many hours of therapy, I think it's more, it also depends how much can the parent also put in. Because Annie said, like the children were not as performing as well. She noticed that the parent support was a little bit lacking there. So you really need to look at weigh out all the different issues and also aspects of the child's life, and also look at like fatigue and what is feasible, because you don't want a child to feel that they are defective and need all this fixing, right? Yeah.
Nafisa, can I add? I just want to add one thing regarding, it's very important for us to empower the parents. Without their support, there is no inclusive. That's why we have this group support. And we try to, so that we can encourage them, empower them, and entertain them. They really need to, I remember one said, I said, what about your husband? Does he allow you to come and attend our support group? He says, because I come back fresh, regenerated. So he enjoys that.
Okay. So the most important part of seeing the children as a whole is that if we give therapy like for 45 to 30 minutes, it's just that part of the day. The kid has the whole day. So we have to integrate the activities to his routine. So it doesn't have to be therapy the whole day. So it's time with my mother, time with my brothers. So it's not just therapy. That happens with most of the kids with special needs. They spend the whole day receiving therapy and they don't have a day like a child.
And the key message that please don't make the whole life of the child rehabilitation services, because child needs development, interaction with his peers, to be in an inclusive environment. And this medical approach or a deficit-based approach to the development of the child, please believe you will never achieve the final goal of inclusion for the child, and never invest these rehabilitation services to education settings. Education is all about opportunities and development.
I think one of the things that I learned when I was really young was that my brother needed a lot of therapy, but my mother did it. We all played with him and played games, and that made it fun, and it was not noticeable that it was actually stimulating his development. And I thought, one day I'm going to become a speech therapist, and I'm going to get paid lots of money to help to play with children, because it's a really cool profession. That's literally my thought when I graduated high school. I thought, this is a really great job. Why is no one else doing this? So to close, we have wait, how many minutes we have still? We have a song at Annie. Oh, you want to? Oh, wait. We have to close. Everybody wants to just give a last key message, and then we will end with a song, and you can dance your way out. Okay. So I'll start with Veronica and Betty. Do you have a final word, a key message to take away? You'd like people a message to take away?
Yeah, the message is for a successful inclusion of children in education, parents are very critical, and leaving them behind means no inclusion. Thank you.
Okay. That it's a global message, left no child behind, because every child matters. And we should value the differences and consider it as an opportunity to develop ourselves to be able to support every child.
So that the barriers are not in our children, the barriers are in a child. Their barriers are found in the environment and in those who don't believe in them. So we are the ones to provoke and to create the access for them. Thank you.
Yeah, the parents are the primary caretakers, so involve them in this program, and it will definitely give the difference. As I said, the early intervention is not based on full type of therapy, it's a full-time engagement with the kids. Thank you.
We value the impact of our projects of inclusion for kids with disabilities, children with disabilities in school, also for the ones that don't have disabilities, and especially the whole community that learn towards inclusion. Don't forget to take abroad with your journey of educational inclusion, inclusive education, the financial side of it. The ones that finance your projects need to learn how miracle and how much is miracle what you are doing. So please take them aboard, charm them, and make them sensitive to what you do.
And the message from us is that use a mix of traditional and digital methodologies, and it should be tailored to the child's needs. So the question about how many hours of therapy should the child need, it should really actually be what can we do to tailor, what plan should we have tailored to the child's needs. And that will help then improve retention and access to education programs. Thank you very much.
Early intervention is the foundation of a successful inclusion. I mean, please stimulate the child as early as possible and provide them with a stimulating environment for him or for her to prove herself and employ her or his potential to the maximum.
Can you give our panelists
Okay, thank you, Nafisa, for giving me the time to share with you. One of our children got the award. Got the award of the best singer in it's a Jordanian national song. So I would like to share, and it is about peace. And there is no peace without equity and equality. So please
enjoy.